رحمن يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن واسق حياتي
ورحمة الله تعالى وبركاته. Good morning. I'm here to discuss this morning in respect to the conflict resolution among healthcare professional Islamic approach. So many things have been said. Research has been conducted on an issue of what is regarded as the conflict, but there are some areas that I observe that it is a gap. Islamic perspective is not taken into consideration. So I'm going to discuss this area. These are my content of the presentation, and then this is the definition of the term. Conflict indicates the class of interests, opinion, principles, and others. Resolution, effective management, and healthcare referred to as a design area that is meant for discharging a healthcare facility, which can be local, international, or local, state, or even the tertiary institution. And then the profession is talking about each and every cadre that's involved in disseminating of healthcare. Then these are my objectives: to identify the cause of conflict and look at the source of the conflict and the Islamic approach to conflict and others. Now, just as a matter of introduction, healthcare is an integrated part of life which no one can escape the experience to consume it, because at times you can be a consumer and at times you can be also a healthcare giver. Healthcare system is in collaboration with different professionals coming from different area of speciality, which they need to come into together in order to discharge an effective services. Healthcare system can only be effective each and every professionals consider patient as a priority. This will help in solidifying effect in order to come together and administer an effective service. Then still, it is really disheartening to discover that a lot of researches reveals that there's an existence conflict either within the healthcare delivery system. Serious havoc of such conflicts were equally reported and affect not only on the patient but also on the healthcare givers. The days where different professionals are contented with their earnings, never think of what other professionals are receiving have gone. The situation have turned into a battlefield that everybody is fighting that he is better and he has upper hand. Concerned anyway from different professionals have conducted a series of researches on this issue. Then looking at the background of the study, that it was observed that by Nasser and others that yes, the issue of conflict is established among healthcare professionals. So many researchers have observed that healthcare delivery has witnessed drastic changes beyond expectation of unpredictable rate. The healthcare industry, which used to be a home of peace and harmony for the caregivers and consumers, have turned into a battleground of very difficult zone for patients because they don't receive what they are expecting. Nigerian health sector has witnessed unhealthy rivalry among healthcare professionals for decades. This has led to so many industrial action and other things that are not healthy to the profession. A caregiver who was happy among those chosen to assist humanity because somebody is humble to be chosen among those that will deliver the health care. But at the end, he becomes arrogant and other things that is not expected from him. Still, the talent that would have been used in order to improve the system has turned into so many things that at least so many things have been losing in the healthcare delivery system. The methodology used is that researches were conducted in order to find out what are those conflicts. Those researches that to talk on these areas were reviewed, and the methodology is that professional conflicts or different profession, and then administrative conflicts, that is healthcare with administrators, and also geopolitical zones were also considered to pick some researches that talk about area of conflict within this area of coverage. So why the conflict? Conflict must occur because then I must ask your own services is interwoven with the others. Then there's going to be so many things, just as other researchers have revealed. Then when we talk about the source of conflict, so many things were said on conflict. Some researchers refer it to as the socio-economic status, interpretation, and overlap of duty. So one observes that there are three major areas that they are more to do with the conflict. So that's what area we took and review. That is why if you look at the majority of the source of conflict, the researchers reported about 30 papers were reviewed, and this is the finding. Renomination take a greater part, almost 58, and the leadership and the role overlap. These are the major ones that were reported by these researchers reviewed. So when we talk about Islamic approach, we know that Islam has a robust system in order to resolve all the other conflicts. These are the three areas whereby if an individual observe the essence of creation, becoming part of the whole, and appreciating one's position, that I'm a doctor, I appreciate it's Almighty Allah that makes me to be in that position, I'm a nurse, I'm so whatever. So these are areas that when we talk, that would be very important. Essence of creation, Almighty Allah has created an individual just to come as a vicegerent. And then he is created just to worship Almighty Allah and becoming part of the whole. It's just like a cell. I'm a cell, and there's a system, there's an organ. If I believe that I am part of the whole, then I have to discharge my duty before everything becomes okay. So these are areas that when we take it into this condition, it will be very. Provision of healthcare services is multidisciplinary, and everybody must participate in order to ensure. Then what an individual needs to take is that whenever the position you are, just take this hadith of the Manzo Sallallahu Alaihi Wasallam, that the best amongst you is he who brings benefit to the other. So your position does not matter. And then what if ana ba'dhum ila ba'd? This is the area of what the renomination. That yes, I know that somebody must be a leader, because it's part of what to observe. Somebody must be a leader. So regardless of what position you find yourself, Almighty Allah must place somebody above others. And then the other one is an issue of what the okay? Yes, Almighty Allah is the one that distributes bounties to each and every person who the way he wish. So whatever placement you find yourself, you just thank God. Don't even feel as if you are relegated. Part of the recommendation is that all Muslim health workers need to reflect on the essence of creation, and this when they render their services, that no professional is better than the other. It's just a placement. Then let all health workers contended with what was the legitimate that they are earning, and let us put fear of Almighty Allah, either a leader or a subordinate. And the last one is, let the student, health workers, let's teach our students that they have to humble themselves, because a part of the finding is that some area of training they do indoctrinate others. The last one is the establishment of Islamic Council of Nigeria, which if each and every profession is governed under one umbrella, maybe we are going to have less conflicts, inshallah. Thank you very much. This is the take-home.
رحمن يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن